Environmental and socioeconomic factors. Factors that make men who have sex with men more vulnerable to syphilis includes having a low socioeconomic status, being uninsured, having barriers to accessing healthcare, homophobia, discrimination, stigma and racism, and sexual risk behaviors. Syphilis affects those who are at a disadvantage in society, particularly among the MSM population. The southern region in the United States, specifically in North Carolina, has one of the highest rates of primary and secondary syphilis cases among MSM in comparison to other regions because of the large concentration of low socioeconomic status and disadvantaged communities. MSM living in poverty face difficulties finding affordable and quality healthcare. There is still a large population, including MSM, that remains uninsured because they cannot afford the pay for the cost of the coverage, or they are not offered employer-sponsored coverage at their jobs unless they are married. Furthermore, there are healthcare facilities or clinics in many areas that do not provide condoms, lubricants, or other materials for MSM to access to protect themselves. Many healthcare providers do not have the appropriate or culturally sensitive treatment to serve them, creating a barrier for them to seek health services. Therefore, many MSM avoid seeking healthcare because they feel uncomfortable talking to the healthcare providers about their sexual activity and having the fear of being judged if they contract syphilis. Stigma and discrimination are also factors that make MSM more vulnerable to contracting syphilis and other STDs. Stress from society's intolerance of homophobia or racism towards color MSM contributes to poor mental health and risky sexual behaviors. MSM individuals often avoid disclosing their sexual orientation and hiding characteristics that will reveal their sexual orientation because they fear of judgment and being treated differently by their families and the people around them. Those who are rejected by their families and have no social support are also more likely to be homeless, abuse drugs and alcohol, become sex workers, and have risky sex because of poor mental health and coping skills. Sexual risk behavior among MSM increases their chance of contracting syphilis as well. Their attitudes towards sex and relationships are more open and liberal, which influences the way they form relationships. MSM were also found to have more spontaneous sexual partners and concurrent partners of different ages. As a result, recruiting new sexual partners increases their risk of contracting syphilis and transmission to other people that they have engaged in sexual practices with.